Hello everyone, my name is Kevin Wang. I'm from Pine House Clinic, and today is March 19th, 11 a.m. I would like to share some of my ideas about this COVID-19 outbreak in BC in Canada, and why we need to prepare for at least 2 months and how should we prepare. By the way, my background is surgical medicine in China, and also I'm a registered nurse in Canada. I worked in the emerge before and also in nursing homes. The cases in BC last Friday was about 70, and now it's more than tripled. So it's increasing really fast. That means it's the beginning of the outbreak. So everyone needs to be serious and really alert and prepared. And the reason why is the nation and the world is so nervous about this virus is because right now we don't have a way to prevent it or stop it or even effectively treat the infection. That means a lot of people will get infected. So the common agreement among the scientists and the top doctors is that if we don't work really hard and together, so maybe two-thirds, that means 60 to 80% of the population will be infected by this virus. If we work together, practice social distancing, hygiene, etc., maybe we can decrease that percentage to 20 to 30%. So maybe just 1/3 of the population will be infected. That's not only Canada, US, China, Europe, that's the whole world. So it's just a different time period which country has outbreaks. So that's really how we should be serious about this pandemic. And we can understand, use the example of seasonal flu or common cold. We don't have any really effective way to be immune to the seasonal flu or common cold, right? We don't have a effective vaccine or really effective medicine to kill the virus. So every year people get sick, and everybody has had flu before. If you had the flu before, you can still have a flu even after a month. So that means we don't have a solid immune defense against the flu virus. And this COVID-19 coronavirus is a kind of flu virus too. So even we are hoping we can have a vaccine or medicine in next year or the end of this year, but that's just a hope. Maybe we can never have effective vaccines. So, but that means that's why so many people will be infected, right? So, why we need to practicing social distance and precautions, even though many of us, people around us will be infected, because like these two curves, right? So, as time goes on, there are more patients. If we don't be prepared, we'll have curve A. There are in some regions there is a curve A, so the number of patients increase dramatically. So it outnumbers the capacity of our treatment, the hospital beds, the medical professionals, and also ventilators, etc. So a lot of people will die because no treatment available. no resources available, too many patients at a short period of time, the death rate will be much higher. So if we prepared and practice social distancing, we can have curve B, the lower one. That means we can slow down the outbreak. Even though the numbers of patients may be the same, but we have less patients at one time, so we have relatively more resources to treat those patients, to reduce the death rate, the number of deaths. That's one major reason. And the other reason is now is March, we still have seasonal flu. So people don't know if they have flu or they have coronavirus infection. So after maybe May, we don't have any more seasonal flu or common cold. The weather is much warmer, so it's more obvious if you have the new coronavirus or not, and people have less chance to get the flu, right? Because the weather is not as cold as the winter, so we can postpone the outbreak and flatten the curve. That's the purpose of what we're doing right now as a country, as a individual citizen. So what we should do? We still need to stay calm and don't panic. Panic causes many unreasonable behaviors and maybe cause more damage or more infection, right? Stay calm, because even though maybe this virus is the most infectious virus we have seen, but it's not as deadly as SARS or as many other viruses. We know the seasonal flu, the death rate is about 1 out of 1,000 or maybe less, or even less. And this COVID-19 virus, the death rate, according to the statistics available now, it's between 0.5% to 2%. So if we don't have a sudden outbreak, so we can control the death rate maybe within 1%. So it's still like 10 times more than seasonal flu. So if we don't control it well, it can be more than 2%. So it's not as deadly as some of the virus like SARS. And young people, when you are under 20, usually you just have very mild symptoms. If you are under like 50, usually 90% you have a mild case. That means you only have some sneezing, some headache, some sore throat, then you recover in 1 or 2 weeks. You don't have to go to the hospital. You don't have to take any prescribed medicine. Only people over 60, especially over 70, there are more chances to be more critical cases, severe cases. That means only 10 to 15% of people need to be hospitalized. So we can still stay calm and protect the elderly people. That's our main purpose. We keep away from the elderly people and also ask the elder people stay home for the next 3 or 4 months. The virus won't go away in a few months, and it may come back. There are consent among the scientists that the virus may come in several waves. So we need to tell the elderly to stay home, stay away of the other people, and especially they live in the condo, so be very careful. So everyone needs to prepare the personal hygiene, the most important thing is hand hygiene. I think you have know how to wash your hand properly as often as possible. If you go out, you should carry a hand sanitizer. This is what I made at home. So use 99% or 91% of alcohol and aloe vera gel 3:1 ratio, and mix them and put it in a small bottle. You can carry it with you and clean your hands when you touch anything. And also at home you should prepare the alcohol spray to spray the surface, especially the toilet, the bathroom dirty area, and the dining area, and some like garbage cans, right? And if someone sneezes, you should spray on against at the floor, and also maybe the clothes when you go out. And if you have mask, you don't have to wear it at home or in outdoors. If you go to indoors to buy, and then you need to wear the mask, I think, especially if you are not very strong, or if over 60, you need to wear mask when shopping, because you need to interact with people, and not only protect yourself but also protect other people. So everyone is possible to be infected, so you may infect other people too, right? So when you go to indoor for shopping or other activity, you need to wear a mask, and it's one-time use, right? Don't use repeatedly. And also sometimes you need gloves, just regular non-sterile gloves when you touch the dirty things, when you clean up the garbage, when you take care of like sick kids, sick people, and when you do the cleaning, use the sanitizing wipes to clean. You should wear a glove and throw away the glove after you finish cleaning. You don't need to wear gloves when you go out, because you may touch different surface and spread the virus. Right? It's better to practice hand hygiene all the time. Yeah, when you use the elevator is the most dangerous space. It's enclosed space. So the virus, if someone sneezes in the elevator, the virus may live there for a few days. So you need to wear a mask, and when you touch the button, it's better to use the toothpick to touch one time use, touch the button and throw them away. Don't use gloves of your hands, right? And also for the family, you have to prepare something to boost your immune system. And this is, I think everyone knows, is vitamin C. You can take 2,000 milligrams a day. It doesn't matter powder or pill. And also you drink it with room temperature water. And then you can take vitamin D. Vitamin D, you can take 1,000 international units a day, 1,000 to improve your immune system, to prevent. If you already have infection, you can take 2,000 international units of vitamin D. And you can also take some probiotic, because this virus hits our digestive mucus too, so people may have nausea, diarrhea, abdominal pain. So the probiotic can protect your digestive immune defense line. So you can take one capsule every day. And what else you can have if you live in a crowded space, you can have a UV light to kill the virus in your room, right? UV light, or I have a air purifier with a UV light inside the machine, so it filters the bacteria and virus and also kills the virus with the UV light. That one I bought on Amazon. But you have a bigger like UV light machine if you have sick people at home. It's better to clean the room every day. Okay, so that's what you need to prepare, and you also need to prepare food for at least 1 month or 2 months, because if you get sick or the adults at home get sick, no one can go out, right? You need to stay home and be isolated, so you cannot go shopping. So you need to prepare food for 1 month or 2 months. You need 2 weeks to recover, and you need 2 more weeks to be isolated, right? So you need food for one month. It's not a lot. You just buy some flour or rice, canned food, some meat, milk, eggs. Yeah, that's enough. Some people like in Asia countries, we can eat raw garlic. Raw garlic is believed to can kill some of the virus and also improve your immune system, because we are isolated. So, and also we wear masks when working, so we don't need to worry about the odor, the smell. So you can eat some raw garlic with food to help yourself. I think it's quite effective. By the way, I also practice like learning acupuncture and traditional Chinese medicine. So I use some herbs, prescribed herbs, to prevent the virus infection. So far, it's quite effective. I feel very, I can feel the immune system is quite strong, and it has ginseng, like ginseng, real good ginseng inside, and other herbs. And also you can practice deep breathing to improve your lung function. Like in a sunny day like today, you can go out, like if there are no people around within 20 meters, you don't need to wear masks. You can practice deep breathing and facing the sun. You can feel the energy go to your body, and it really helps your immune system clean up your airway and the lung, right? So deep breathing, very important. So if you have any questions, you can leave a message. I can reply to you, and we can share the ideas and the tips how to fight this virus together. Yeah, I think the whole human being, the whole world is now have to work coordinately and fight as one against this virus. Thank you. Take care.